Iulia Iatan and Mike Gibson coming to you live from ACC 2023, and we are talking about ketogenic diets. I know this has been, something that many of us have tried. I know when I go on a ketogenic diet, I lose weight, my HDL goes up, but then I rebound. You've actually studied this. So, Yulia, talk to us about what you did and what you found.
Yeah, definitely. Thanks a lot, Dr. Gibson. Yeah, so in our study, we were actually interested in looking at what's the relationship between a low carbohydrate, high fat diet and plasma lipid levels, especially LDL cholesterol levels, as you know, that the bad cholesterol, and the relationship between this diet, LDL cholesterol levels, and also major adverse cardiovascular events. And the rationale behind our study was that in the cardiovascular prevention clinic, we would get referrals for patients with very high cholesterol, meeting criteria for familial hypercholesterolemia. So LDL cholesterol above, millimoles per liter of more than 5 or more than 190 milligrams per deciliter. And so some of these patients actually had normal baseline cholesterol levels, and also some of them had evidence of new either clinical or subclinical atherosclerosis. So with this in mind, we decided to look at the UK Biobank. So, in a nutshell, and, I would say somewhat large population-based cohort study from the UK Biobank, we noticed that consumption of a self-reported diet low in carbohydrates, so not meeting ketogenic criteria. So how we defined our diet was low in carbohydrates, less than 25% of total daily energy intake, or less than 100 grams of carbohydrates per day, and high in fat, so more than 45% of total daily energy intake from fat. So we found that this type of dietary pattern was actually associated with significantly higher levels of LDL cholesterol, ApoB, and also a greater risk of incident cardiovascular events. And I think what's important to mention is that this dietary pattern, the way that we defined it, it's a bit different than a ketogenic diet, and that's why we really called it low carb, high fat diet. A ketogenic diet usually involves quite a restriction, quite a severe restriction in carbohydrates, less than 10% of the total daily energy intake. We use less than 25%. And a ketogenic diet per se has the fat content is more than 70% of the total daily energy intake. Our diet was more than 45%. So we try to, I guess, modify it a bit. And so that's why we called it low carb, high fat diet.
And what happened to HDL? Did you look at HDL levels?
Yeah, so HDL levels, actually, there was a significant increase in HDL levels between the standard diet and the low carb, high fat diet. A small increase, but significant nevertheless. Yeah. And
How accurate are these kinds of reported food intakes? I mean, and how consistently, and what is the longevity of that kind of reported food intake?
Yeah, so it's a good question. So our study, it's an observational study, and we used the dietary pattern that we used, or the way that we can quantify the dietary pattern was using a 24-hour questionnaires at one time point. And although this is one time point, what we noticed is that a follow-up of approximately 12 years actually led to a twofold increase in high risk of MACE, so incident atherosclerotic cardiovascular events, as compared to patients on the low carb, high fat diet, as compared to the ones on the standard diet. So yes, there's definitely the possibility that the patients during this time can go on and off the diet, that their diet could change, but we think that it's still, there's a somewhat significant risk associated with starting this diet. Yeah.
So, Yulia, is this ready for prime time? I mean, what's your recommendation at the end of your study?
Yeah. So what we're really recommending is that patients who start this diet actually, if possible, do so with, in conjunction with talking with a healthcare provider. And especially if not necessarily talking to a healthcare provider, measuring their lipid levels, so cholesterol levels before and especially while on the diet. And if somebody is at risk of other, if they have other cardiovascular risk factors, for example, diabetes, obesity, to try to also address them at the same time. Yeah.
Right. Well, I mean, many of us have tried this diet. This is very, a little bit disquieting information. Thanks for sharing it, Yulia. Thanks to all of you for joining us here from ACC 2023.